Good morning, everyone, or good afternoon, depending on who's dialing in from different time zones. My name is Christine Hare. I'm the Data and Research Consultant at the WFH. Thanks for waiting for us as we just waited for everyone to jump on the line this morning. Welcome to the WFH World Bleeding Disorder Registry Kickoff Webinar. A huge thank you for joining us today. So to start with, I'm just going to go over a little bit of housekeeping, and I'm going to walk you through some of the webinar interface functions. So if you're looking at your screen right now, you'll see on the left, there's a chat box. We encourage you to log on here to say hi to all the other listeners on the line, write a message and let us know where you're calling in from, what part of the world. The second part on the left is the polling questions. So we'll be using those in a couple of slides to ask you some questions and get a better idea of where you're calling in from. And then there's the questions box. If you type a question in here, it comes directly to us speakers on the line. So if you think of something as we're talking and as we're presenting, feel free to just type it in, and we'll save some time at the end of the webinar to go through all your questions and try our best to answer them. Then there's a resources link. We have a couple of links here and a couple of documents that we thought would be useful for you during this webinar. You're welcome to click on them now, and just as a point of reference, at the end of the webinar, you will receive all of these by an email as an attachment. There is at the bottom left a request technical support. Please, if you're having any difficulty with the webinar, with sound, feel free to use that. On the right-hand side of your webinar, there is a notes section. You can type anything in here, and this is just for your personal use, and you will receive a copy of this at the end of the webinar. I hope that's clear. Please feel free if you have any questions to let us know, and welcome again. So now I'm going to walk you through today's goals. Number one, we want to provide you an overview of the World Bleeding Disorder Registry. We're going to review some important information and processes for participating in the program. And then we're going to offer you an opportunity to ask us some questions and to provide any comments. To take a quick look at the agenda, we will start off with a background, getting into the pilot studies, the results of that, and the learnings we've had. Then we're going to talk about global implementation, and we'll just kind of dive a little bit deeper in this, going into the timeline, the eligibility and enrollment, patient privacy standards, how you can access your HTC data, HTC requirements to participate, and the ethics approval process. We'll finish off with some next things and stuff that you can look forward to, and then questions and feedback at the end. So I've already introduced myself, Christine Hare. I wanted you to become familiar with the rest of the team at the World Federation of Hemophilia who's working on the World Bleeding Disorder Registry. Our director is Donna Coffin. Then we have Mace Nakash, who's our Data and Research Manager, and she'll be joining us this morning shortly as a speaker, so you'll get to hear from her. And then Jennifer Brennan, our Research and Public Policy Assistant. So now you've heard a little bit from us about who we are and what we're going to get into today. So we have a few polling questions where we want to hear from you and get a better idea of who's on the line right now. And so this webinar, we invited hemophilia treatment centers around the world who are interested in participating, but we also extended the invite to a lot of different people from national member organizations and interested stakeholders. So we want to hear from you who's on the line today, and a polling question should be popping up soon so that you can answer. So 50% are dialing in from a hemophilia treatment center. We have some interested stakeholders, which is great to see, and we do have some national member organization representatives at 21%. So great to have you. Thank you very much. The next slide is our second polling question. It's, did you participate in the World Bleeding Disorder Registry pilot study? So this is the pilot study that happened last year, and we will talk about that in a couple of slides, but are you one of the treatment centers that was participating in this? Great, so we see the results now. So we have 71% who are new to the World Bleeding Disorder Registry. Welcome, great to have you. And we do have some centers who were part of it last year, so 28%. That's great to see. Our third poll for you is, what region of the world are you from? So we'll open the poll. These are the World Health Organization 6 regions of the world. Oh, fantastic. you'll see we have from all corners of the world, 29%, a strong representation from Africa, 22% from Southeast Asia, and 14% from Europe, 33% from Americas. That's great. So our last polling question of this morning is, have you already applied to participate in the WBDR? And so this is the either SurveyMonkey or PDF version of the application form. Have you already submitted this to the WFH and are ready to be on board? Great, so it's about half and half. We have 47% who've already participated and they're ready to hear about the next steps, and 52% who are new. So thank you for bearing with us. We think it gives a little bit of a background of who the listeners are this morning. So now what I'm going to do is introduce you to our next speaker. Glenn Pierce, the chair of the WBDR steering committee, was supposed to be joining us this morning, and unfortunately he's on a flight right now. But Jamie O'Hara has kindly offered to step in and offer some introductory remarks. So thank you very much. Jamie is a member of the WBDR steering committee. He also sits on the WFH Data and Demographics Committee. So I'm going to hand it over to Jamie right now. Again, thank you so much for joining us.
Thanks very much, Christine. Thanks very much, everybody, for joining today. We're thrilled that there's so much interest in this. You can see my picture, it's just come up. That's me singing. So in terms of where we are to date, I think before we go into what the registry is and some of the detail, I think it's very important to congratulate and thank the team from within the WFH who've worked on this. So Donna and her team have done a phenomenal job in getting this to this stage. So thank you to them to begin with, and thank you to all you guys who've been making it happen so far. So in terms of where we're getting to, there's a lot of excitement around this project. It's the first time that we've had an initiative where we've been collecting harmonized data from across different income, different levels of income countries. So we're starting to be able to develop a methodology whereby we can understand the disparities in healthcare across the globe, which is something that we really want to dig into. So yeah, that's in terms of an introduction. As you can see, we've got a very comprehensive steering committee. It's been chaired by Dr. Glenn Pierce, and we have membership going right across different disciplines in order to ensure we had comprehensive input. So we have health economists, we have existing registry managers. Obviously, we have a heavy hematology presence there as well, and we have the representatives from the UK and Canadian registries as well, in order to ensure comprehension and that we had the appropriate expertise to develop a good plan and a good platform from which we can execute this very exciting project. So in terms of what the strategy is and why we're doing this, it's very important to get the context right here. We're in an environment globally whereby you need to substantiate common sense, and that is no different for us as patient advocates. We need to initiate and be responsible for the delivery of evidence-based advocacy, and we feel this is an absolutely essential step in terms of being able to deliver that. So that is the reason why we've initiated this. We have a harmonized or standard data collection approach, which will facilitate the capture of a never before seen data set globally, as I mentioned previously, across different income level countries, which will provide and facilitate the ability for us to conduct good quality research that is credible, and therefore can provide messages to substantiate why we require access to better treatment and better standards of care for our patients. So really this is a first step on it, and we are on the road to telling the story that we want to tell, but it's absolutely imperative that we have good data, and we feel this is the platform that can deliver that. So in terms of the core strategy, that is it. We feel that this global registry will give us a harmonized data set, and it will enable the regions to be able to deliver good quality evidence-based advocacy that can ultimately support the standard of care for haemophilia patients moving forward. Thank you.
Thank you very much, Jamie. That was a great introduction, and we really appreciate you joining us this morning. So I'm going to take from where Jamie left off and move over a little bit into the pilot study for those who aren't familiar with it. And so prior to rolling out a large registry, we decided to conduct a study to assess the feasibility of implementing a global patient registry in HTCs around the world. So this took place from April to December, a very short timeline of 9 months in 2016. And we were looking at 4 major performance indicators. 1, verifying if HTCs were interested in participating. 2, whether HTCs could obtain ethics approval. 3, whether patients would consent to participate in the registry. And 4, whether HTCs would be able to enter data in the web-based data entry system. And so looking at here, these are our very top line results. We can see that we had 26 hemophilia treatment centers around the world from 25 countries. We had 2 in India, and you can see the regional representation in those circles. And we had 356 people with hemophilia enrolled. So this was a terrific kind of outcome for such a short period of time. So to look at some of the pilot study learnings, it was really important for us to get the feedback from the pilot centers who participated, and we saw this morning in the polling questions that we do have some logged on today. The pilot study was a very positive experience, and really the WFH has been committed to working collaboratively and taking these learnings from the pilot and making things easier as we move to the full-scale WBDR so that HTCs can be more successful, and we really want to put you in a good position to continue with the full scale. So you can see a couple of things here that were identified by HTCs on the pilot and how we've moved forward to address these in the full scale WBDR. So this brings us to the full scale global launch. On a very high level, the WBDR is the only global registry collecting standardized clinical data on people with hemophilia from around the world. The WBDR could ultimately improve the quality and access to care for all people living with hemophilia. So what is it? It's a privacy-protected, online, web-based data entry system that will provide a platform for a network of HTCs around the world to collect data. So on some of these issues, Mace will be speaking soon about the privacy protection and the data entry system. And to look at the study design, it's a prospective, longitudinal, and observational registry of patients with hemophilia A and B. So this is a reminder that it truly is a global community effort, and that's why we have everyone here on the call today and starting off with this webinar. We're really dependent on each other, from the hemophilia treatment centers, the national member organizations, and people with hemophilia. Everyone is going to play a part to contribute in this. And I think together we can help the WBDR really reach its potential. And we really are looking forward to working with you and helping you to be more involved and to help make the WBDR your own. So if you look at the red box on the right, it says that the WBDR presents an opportunity to contribute data to advance the understanding and care of people with hemophilia worldwide and support evidence-based advocacy initiatives. So I'm going to leave you at this, and I'm going to now introduce you to Mace, who's our data and research manager. I'm sure some of you have emailed with her before, and so I'm just going to pass it over to her right now. Thank you, Mace.
Thanks, Christine, for the introduction. So as she just said, my name is Mace Nakash. I'm the new data and research manager here at the WFH. And I'm going to pick up from where she left, basically talking about the importance of each player for the success of the WBDR. And here I want to talk about our partners for the development of the database. So the database is being built through a collaboration between the 3 parties you see on the slide, the WFH here in Canada, but also Karolinska Institute in Sweden, and Health Solutions, also based in Sweden. Health Solution has a lot of expertise building patient registries. They've built patient registries in over 20 diagnoses in countries across Europe, but also in Africa and Asia. So for the moment, the WBDR is for hemophilia A or B patients who receive care at an HCC which will participate in the WBDR. We really encourage participating HCCs to talk about the registry with their eligible patients before or during a clinic visit to see if they would like to join. We'll be providing centers with WBDR documents to help keep the line of communication open with the patients. And then if the patient accepts and want to enroll, they'll have to sign an informed consent form. An important part of the program for all of us involved is ensuring the security of the data. To that end, we have many standards in place, as you can see on this slide. As I mentioned, our database provider, Health Solution, is based in Sweden, and so they have to adhere to current European and Swedish standards. We're also aware of the new General Data Protection Regulation, which is coming into effect in May 2018 in Europe, and the WBDR will be compliant. In terms of a timeline for the database, we're currently working on the MDS, the minimal data set, and it will be ready at the end of January, so very soon. And some of the first centers who will start inputting data may be asked to help us with the field testing. Once the MDS is done, we will start working on the extended data set, and that should be ready mid-2018. In 2018, we also want to work on a patient app to record bleeds and treatments, and we may add some patient-reported outcomes to the database. So what is in our minimal data set? You can see here, there will be some demographics data, such as date of birth, gender, and country of residence. We'll also have some data on diagnosis, such as the date of the diagnosis, hemophilia type, severity, and factor level, as well as some information on disease history. This data, the demographics and diagnostics data, will only be entered once, the first time the patient is entered in the registry. Then, at each clinic visit, some basic data related to hemophilia will be collected. Bleeding events, target joints, treatments, inhibitor status, and hospitalization. Mortality will only be collected if necessary. The extended data set will essentially look at the same outcomes, but go into more details. Each patient who participates in the registry will have a unique patient ID. This ID will be computer generated, so the moment you save their data, the ID will come up on your screen. We're preparing ID cards to write down the ID on and give to the patient so they can have it with them. And this ID will be developed in a way to avoid duplicate patients. So yeah, that's very important to us. And if a patient transfers from one HCC to another HCC, which is also participating in the WBDR, they'll keep their ID with them, so they just take it. Here you see our goals over the first 5 years of the WBDR. We want to establish the registry in 50 countries, 200 HCCs, and would like to have 10,000 patients registered. For our first year, you see the numbers here. So we initially already want to be in those 50 countries, but with 75 HCCs and 1,000 patients. We're really excited to meet the milestones towards these goals, and we will be sharing them with the WBDR community through periodic updates. So to reach our goals, this really has to be a collaborative effort. Christine touched up on it right before I started my slides. So it's an effort between the WFH, the NMOs, the HCCs, and the patients. And this collaborative effort could help us create an environment everyone is comfortable working in and lead us to reach our goals and exceed them. So with that in mind, we set our implementation process as such. First, the NMO receives an information letter. Second, the HCC receives an official invitation to participate in the WBDR. And then when the HCC and the database are ready, patients will be asked to join the registry. Practically speaking, we want to reach out to the 134 national member organizations of the WFH to present the WBDR. We started sending letters in October and November, and some of you on the line may have received it already. We will continue sending these letters in the new year. Once the NMO in a country has been contacted, we start contacting the HCCs in that country. We started sending out those invitation letters in November, and we aim to send about 200 by the time we finish our initial implementation phase. If you have not received the letter yet, whether it be at the NMO level or at the HCC level, but you're interested in the project, you can reach out to us. You can email us or simply fill out the HCC application form, which is linked in the resource section of your screen. in this webinar. And finally, our goal is to have the first patient entered in the registry in January. This is coming up very soon. It's in a little less than 2 months, and so we're really excited about that. This map just shows you the countries that are members of the WFH. It shows the impact we can make if we all come together. We could create a registry that really spreads the entire planet and have a really extensive set of data. I also just want to point out that countries with an established patient registries who are interested in linking with the WBDR will require a data linkage strategy, and we will work with these countries on a case-by-case basis. For my last few slides, I just want to talk a little bit more about the data. So in order to ensure the quality of our data, we have developed a data management plan. We will have automated edit checks, logical checks, and automated missing value checks. Clinic staff will also be able to view patient summary and review it to make sure it is correct. Regional managers will also be able to help if needed. In terms of data flow in the registry, all the data entered by HTCs will be stored in one central location in Sweden. However, each HTC will always have access to their own data and only their own data. This means that no HTC can see another center's data, unless they decide they want to share, in which case HTCs within a country will have the ability to pool their data to get countrywide data through a data sharing agreement. Participating HTCs will also be given the opportunity to submit research questions to the WBDR Research Committee. The Research Committee will be composed of members of the WBDR Steering Committee. It'll be there to guide the use of the registry data, assess external applications for its utilization, and also encourage its dissemination. With that said, I think I've covered all of the more technical aspects of the WBDR, and I will hand it back over to Christine for the rest of the webinar.
Thank you so much, Mace. So I hope that gave everyone a good idea on some of the technical aspects, and I'm going to talk to you now about the kind of next steps in participation and the requirements for HTCs. So this first slide, I think, gives a very good high level of the steps for HTCs, and I'm going to walk you through each one of them. So one is to ensure HTC criteria are met, and these are questions that are asked in the WBDR application form. 2, obtain ethics approval. 3, you'll receive training on the WBDR database. And then 4, on an ongoing basis, you'll talk to each eligible patient to obtain informed consent, and on an ongoing basis, you'll input patient data into the database. So we really had, this goes over the HTC requirements. We did develop some HTC criteria for participation. Were considered because we wanted to allow for the uniform collection of standardized patient data. So I have 8 points here, and I'm going to talk to each one of them. So one is the first step is to complete HTC application form. I think you've heard us talking about this a few times. It's in the resources. These are preliminary questions that we want to ask you and some contact details about your HTC. So please reach out to us if you have any questions. Second is that we ask that you have reliable access to the internet. This is a web-based data entry system. We do understand that people are coming from all corners of the world and will have different internet levels of internet access. We completely recognize this. 3 is consecutive enrollment. We're asking HTCs to enroll each consecutive patient that comes into their clinic. We want a representation of all severities and different types of hemophilia. So we don't want you just to select certain patients. It's really consecutive enrollment. The next is long-term commitment. We're saying this from the start. We want everyone to know in advance that this is a long-term effort. We want follow-up data on patients to be entered. Number 5 is ethics approval. So this is your first big hurdle to get through as an HTC in the WBDR, is to get the ethics approval letter and to send us a copy so that we know that you have this. In the event that maybe your local ethics committee states that participation in the WBDR does not require ethics approval, please send us a letter from the committee saying that ethics is not needed. And the next couple of slides are dedicated to the ethics approval process, so you'll hear more about that then. Then informed patient consent. We recognize that this might depend on what is culturally appropriate in your local environment, whether it's verbal or written consent, but we do require for there to be informed patient consent. And then data entry. We want to know that there'll be somebody responsible for data entry, whether it's a doctor, a nurse, a research assistant, someone from the national member organization who wants to help with this. And the last is language. The database for right now is in English. However, we're going to do our best to help you through this in different languages. So we will have print versions translated of the minimal data set and any accompanying documentation that you may need for ethics or for patient discussion will have translated. We're looking at French, at Spanish, at Russian, Arabic, but please let us know if there's something else that we should look at. So if you've heard me now and you're wondering about any of these and whether you meet the requirements, please just feel free to reach out to us and talk to us about that. So now to get into a little bit more the ethics approval process. So once you submitted your WBDR application form, the next things that you need to look at is the date of your next ethics committee or institutional review board meeting, the deadline to submit the required documents, and what documents and forms are required for your submission. So right now, we have 38 HTCs who are going through this process, and we're helping getting their proposals together and ready for submission. So we will provide you an ethics package that will help with your application for ethics. Included in this package are a number of documents. First is a WBDR ethics approval letter and a copy of our final protocol. There will be a consent and assets form. So these are templates that you can take and adapt to your local environment and modify as needed. And then we'll give you a copy of our data collection tools, so the HTC registration form and the minimal data set. There'll be an introduction letter. So this is a kind of a background information letter about the World Federation of Hemophilia, stating that the WFH is a nonprofit organization. And what was done in the pilot, and we hope to do again, it was successful, was that this introduction letter can be used to request that the fees be waived for your ethics application. And then there's a frequently asked questions document that goes into some of the questions that might come up in the process. And again, that's copied over in the resources if you want to take a look at that now. And so how we can support you through the ethics. We know that it's a first big step for you to get through, and there might be a lot of back and forth for required submission for your ethics committee application. And so we are here to help you as much as we can. If it first is modifying and providing required documents, so your ethics committee might ask for something very specific, a special request, please reach out to us and let us know what that is, and we will do our best to prepare it for you or to help you put it together. An example from the pilot study is some ethics committees wanted to see a list of other countries who are participating in the World Bleeding Disorder Registry. So we do understand that there will be specific and kind of special requests there. Translation into local languages. So again, we're doing our best to have at least the consent, the asset form, the introduction letter available in different languages. But if there's something that you really need, please let us know. And again, we're available over email. If you want to hop on a teleconference line with us, we can go through the process. If you're having any trouble, we're more than happy to help you get through this. So now we're going to move away from ethics and kind of give you an idea of what's to come, how the WFH is going to provide ongoing support, updates, and training for the WBDR, and really what you can look forward to as you participate. So the HTC Toolkit and online portal, these are just going to be an easy way for you to access all the documentation from ethics and training and patient discussion program tools. And that was just then to the patient discussion program tool. So we've prepared a brochure and a poster that I'll be showing you in the next slide that you can use to interact when you're doing enrollment of patients at your HTC. Looking at database training material, we'll be preparing a user handbook. We'll have videos to help show how to do data entry. Webinars, I hope you're enjoying this one today, and to let you know that there's more to come. So we'll be preparing the next one on probably database entry and data quality. So you can look forward to that in the new year. We will be doing some in-person training so we can touch base with you. And then please expect to hear from us from program update e-newsletter series. And so this will be really a great way to let you know about the updates, to share best practices, to see the progress and how we're working towards our targets, and we'll be able to show you the milestones through these e-newsletter updates. And so please, if there are any other tools that you might need to help you feel more successful in the program or to feel more successful with patient discussion, please let us know. We'd love to hear some feedback. So I said I was going to tease you with an example of the patient discussion program tool. So here are our gorgeous looking poster on the left and our patient brochure on the right. We will have hard copies available of these in English, French, and Spanish that you can take directly to your HTC and use. And then I spoke a little bit about in-person training. And so the next big one that we're going to have is at Congress 2018 in Scotland. So we will be having an investigator meeting for those of you who are attending, or if there's a member of your HTC who's attending Congress. We really look forward to meeting you in person, having kind of some hands-on training, and then also kind of a touch point to see how people are doing and get some feedback on progress. So that is the last slide for today. We're going to transition now over into some questions and feedback. Please, you'll take note on the left, you do have that question box. Feel free to type some questions in there. We'll do our best to respond to you. If for some reason we don't get to your, run out of time and we don't get to your question today, please shoot us an email. We want to be here to answer all of your questions. So one of the questions was, will we have an in-person database training like we did for the pilot study? So yes, absolutely. The pilot study, we had an in-person training at Congress in Orlando, and we're expecting to do the same thing, like I said, at Congress in Scotland.
There's a question regarding whether or not we're connected to ATHEN, and the answer is no, we're not connected to ATHEN right now, but we will hopefully be working with them to try to do some data linkage. As I mentioned earlier, it's really a case-by-case situation when we want to link with other registries. Just to clarify, ATHEN is a big registry in the US, and so yeah, we, if possible, as I said, would like to link with them. Another question that came in is, if the patient has forgotten the exact factor assay done in the past, do we have to repeat the assay for the WBDR? The answer is no. We have built the database in such a way that it's flexible enough to enter the data you do know, and hopefully, you'll find all the information you need in there, and we're flexible to adjust if we find situations arise frequently.
Okay, so we have a couple of questions as well on the role of the National Member Organization in supporting the World Bleeding Disorder Registry after the HCC is collected, and how they can perhaps access the data as well so that they can use it for advocacy purposes. So really from the start from this, we wanted to inform the NMOs that it's happening so that everyone can be on board, especially with promoting it at your HTC and promoting it with patients with hemophilia in your country. Like I said before, it's really a global kind of community effort that we need, not just the HTCs, we need the NMOs on board, we need people with hemophilia on board to promote this. So yes, we definitely want your support and want you to support the HTC with this program, and wanted you to be informed from the very start that this was happening at the WFH. In terms of accessing data, Mace spoke a little bit, and feel free to jump in, Mace, about kind of pooling country data together and getting an idea of countrywide data. We would love for there to be maybe top-level data that can be shared with the NMO. We really want this to be used, especially for advocacy, and to get a better idea of what's happening in your country. So we had a comment coming in, I think, for Nigeria, that for the ethics approval process, they'll need a comprehensive protocol for submission. So absolutely, we do have a protocol that we'll be sending you in the required documentation. If you do not think it's extensive enough, we could provide you with more background, but I think it should cover your needs.
There's also a question about how to deal with a patient who is treated in 2 different HTCs. And we have capacity in the database to transfer a patient back and forth. So when the patient, comes into one HCC, they can take his file via his ID, enter the data, and then if he transfers back to the other HCC, they do the same thing. They kind of take him. So it shouldn't be an issue there.
So there's a question that came in, are we going to continue with the annual global survey as we continue with the World Bleeding Disorder Registry? So that's a great question. So the annual global survey is we've been doing it since 1999 at the WFH, and it really is demographic data that the national member organizations are asked to submit every year. And absolutely, we will be continuing with that. That's very top level country data and gives us the most comprehensive right now picture of what's going on a global scale. The World Bleeding Disorder Registry is patient clinical data that's collected at the Hemophilia Treatment Center. And so it is a little bit different. Both of them, and you're happy to reach out to me if you would like some more information about this, but we will be continuing with the annual global survey.
There's a question here as well about, can the WBDR financially support a stipend for additional people helping with data entry? The answer is we're looking into it, and feel free to reach out to us if you want to discuss it more. There's also a question about how many people per HCC will be able to enter the data. And the answer is basically as many as you want. So there will be a clinic administrator within the database, and that person will have the capacity to make people data entry, give the capacity for people to do data entry. So create a username and login.
Great. There was a question on what kind of information the HTCs will receive and sort of reports. And so, yes, we're planning on putting together a great annual report based on the data from the WBDR, and we'll really look forward to sharing that with you. There's a positive comment coming in that's really appreciated, saying that they think this is going to be a great program that unites patients and specialists all over the world, and they really hope that the program is going to be successful. So thank you very much for that. I see a question above on will there be a demonstration of how the software works? I don't think we've touched on this one, have we, Mace?
Yes, and we do hope to have a demonstration once the database is ready, so we can take people through it.
Exactly. So we'll have hopefully a great webinar that goes over data entry and the main points that you need to know. And then for you to take home from that, there'll be a user handbook that you can use, and there'll be videos posted online if you need a refresher of how to do that.
We're also available for one-on-one explanation if needed as well. I saw a little earlier there was a question from Latvia, I believe, about linking, and the answer is yes, but it's a case-by-case basis, so just reach out to us so I can reach out to you, and we can start the discussion to link the registries. There's another question about when the WBDR will start, and so we're hoping for the MDS to be ready at the end of January and our first patient to be in at the same time.
Exactly, and they also asked more about the in-person training. So that's really for representatives who are going to Congress. So if you're not going to Congress, but maybe a member of your team is, or one of your colleagues, then they can be invited. So we'll try to meet everyone there.
And yes, if a country is in the process of building their own registry, we would love to speak with you and develop things together to make sure we can link or do them together, to discuss our options and move forward together. So feel free to reach out to us, or I can reach out to you as well.
Just give us a moment here while we're moderating, going through all the questions. There's quite a number that are coming in. There's a question regarding HCC and access to the internet. So I spoke about that earlier and said that we understand that people have different levels of access to the internet. And so somebody was asking that if the hospital has only an on-paper registry and almost no internet, whether they'll still be eligible. So please reach out to us if that's your country or if that's a concern that you have. It is a web-based data entry system, so there has to be some way to enter the data online. So we can talk about some workarounds and look at that situation more carefully. There's another question coming in about, do I have to enter a certain number of patients? So Mace showed you the world map and the number of countries that are involved in the WBDR. There's some countries that might have 12 patients at their HCC, and there's some that might have hundreds. We are open to everyone being involved and want this to be inclusive to everyone, every member at the WFH. And so the only important thing is really what I spoke about before about a consecutive enrollment, that we want you enrolling all of the patients at your HTC. Another question that came in, whether, talking about the differences between the hemophilia treatment centers and the national member organization. So this has come up a couple of times now. And so really it is the hemophilia treatment centers that we're asking to input the data, and it's patient clinical data. And so the NMOs are more there as a supportive role, and perhaps different scenarios in different countries, whether they need help with data entry. And again, if that breakdown isn't clear, feel free to reach out to me and we can give you a breakdown.
There was a question about whether or not blood draws will be required, or it's simply the data that we have collected in the clinic. It is simply the data collected in the clinic. So we do ask for results sometimes from blood tests, but if you don't have them, that's okay too. We just want the data.
Somebody asked, what if my patient refused and you're not able to get informed consent? We will be providing, similar to the pilot study, a patient log where you can go through which patients you've talked with about the WBDR for enrollment, whether you receive informed consent or whether they refuse. And that information will be really interesting to us to see if a patient refuses to take part, and we'll keep track of that. But that's not a problem if a patient refuses to take part. I think this is coming down to the end of the questions here. There's just a few minutes left on the webinar. Another question coming in that somebody's happy to participate, so that's really, really positive, and we're really happy to hear that. Thank you for bearing with us today on our first World Bleeding Disorder Registry webinar as we kind of learned the program and went through all the questions together. So we really appreciate you joining us today. Just to let you know, a recording of this will be made available. So if you think that you'd like to share it with your colleagues and if they could benefit from it, that would be really great, and we'll keep you posted. You will receive the resources. Our email address is wbdr@wfh.org. Please feel free. We'd love to hear from you. If we didn't get to your question today and you want something, a little bit more information, just send us an email. If you have feedback on how we can improve this webinar, we're really looking forward to hosting some in 2018. Please let us know. Thank you again for joining. It's really great. I'm seeing there's still a couple of questions coming in. If we don't get them today, we'll see the names and we'll be able to email you personally. So that's really great. I know there's a lot to unpack today. We kind of filled you with a ton of information. So really, as a last takeaway, the first big step is for hemophilia treatment centers to get through the ethics process and to let us know once that's secured in your country. And then to remember, starting off in 2018, we have some really great training tools in place before you start on data collection, and we look forward to keeping you updated. So thank you again for your engagement today. Fantastic to see so many questions coming in, and we'll be in touch with you soon. Enjoy the rest of your day.